Dr. Benwill, thank you very much for joining us. As we learned recently, infectious disease can be just a plain right away, the title of this segment. Ebola, of course, made the news, but it's just one of many infectious diseases that we've heard about over recent years. It seemed to have come out of nowhere. SARS, West Nile, H1N1, mad cow disease, the bird flu. Why all of this? Has something changed, and if so, what?
Well, I think looking back at our history, infectious disease has predominated many outbreaks and disease burden of the entire world. I don't think necessarily anything has changed, but maybe our perception has changed. 100 years ago, infectious disease ruled the most common reasons people were dying in the United States. And now we are just dealing with the chronic medical conditions. The vast majority of the tropical world is experiencing a lot of those infectious disease that the United States had more than 100 years ago.
HIV originated in monkeys. Ebola, we just experienced in fruit bats. Influenza, pigs and birds. What's the connection between animals and humans with respect to infectious disease?
So we know that animals carry viruses and that they are in their environment. And when humans come into their environment and get exposed to that virus, these viruses have some propensity, their makeup, which makes them able to cause infections in humans. As we try to understand some of these viruses more, hopefully that will lead to further research and information about why certain viruses, other infections, start in animals and actually come to us humans.
Let's get some definitions here. What's the difference between an infectious disease outbreak, an infectious disease epidemic, and when does an epidemic become a pandemic?
An outbreak is, it can mean several things. One of which, if a new disease develops in a certain population that has never seen that before, or at one time was eradicated. Measles is a good example. Here in the state of Texas, if we had a measles case, that would be considered an outbreak because it's a vaccine-preventable disease and normally is not causing any infections here. A epidemic, and the difference between an epidemic and a pandemic is very similar. It's just on a scale and size. Epidemic is more cases involving more people, but usually involves the onset of the infection, more rapid progression, and can cause worse disease in a short amount of time. Pandemic is when it reaches usually continents or across the world. That's when we consider it a pandemic.
You cited history a moment ago. In your opinion, what would you cite as the most significant pandemics in history?
That's a good question. There are many pandemics and ones that we are still experiencing right now, which would be HIV/AIDS, which is still ongoing and has caused significant deaths across the world. Ones that we learn in school, like bubonic plague, comes to mind for a very significant pandemic in our past history. A success story for a previous pandemic would be smallpox that caused many millions of deaths, but was virtually eradicated with vaccine and having world organizations make it a mission to eradicate smallpox.
See if this is related. The 1918 flu, was that an epidemic or a pandemic, or how do you define that instance in our history?
It would definitely be a pandemic based on the number of people that were involved and the degree of deaths and mortality associated with that infection.
Well, on the subject of flu, many infectious disease experts say that a strain of influenza has the greatest capacity to become the next worldwide pandemic. We have vaccines for flu, so why are they saying that?
Flu or influenza has in its DNA, its genetic component, the ability to mutate, where it causes changes of its DNA. And so it can change, and it can change rapidly. So the flu vaccine that we administer, which is recommended to prevent influenza, researchers, scientists use models looking at what is the predominant circulating flu in the environment, what has historically been shown, using models to predict which flu is going to be circulating and which flus they should target in the flu vaccine. And so even though you get the flu vaccine, you can still get the flu just because of the mutation and the realization of which flu is predominantly circulating in the world or in the environment where you are.
You're an infectious disease specialist. What are the infectious diseases that most concern you?
Here in the United States, what is very concerning is bacteria that are drug resistant to commonly used antibiotics. And that is a concern here in the United States, that the arsenal, so to speak, of antibiotics is limited because of bacteria outsmarting these antibiotics. And so you could potentially have a bacteria that we can't treat. Another serious infection would be multi-drug resistant TB, which is causing many deaths around the world, and could have a serious impact for us treating a disease that can be prevented and eradicated.
Halting international air travel, spending millions of dollars developing a vaccine for every new virus that pops up may not be practical. So what are the answers toward avoiding worldwide spread of infectious disease?
I think it's going to, as sort of what Ebola has shown and other previous outbreaks, that will take a concerted effort on the WHO, the CDC, and controlling and monitoring infections around the world. It's going to take a tremendous effort to keep tracks of other infections that are going around in the world that might not have an effect on the United States or here with the people of Texas, but can have a dramatic impact on our lives if we don't help other countries or services that need aid, so to prevent catastrophe or issues here in the United States.
Here in Texas, and not far away from here in Dallas, we just had a very recent experience with Ebola. What did we learn from that?
I think it's very important, and what we've learned is travel history is important. When I see a patient and they have fever, it's important where they've been, who they've been in contact with. And it's made other healthcare providers and the lay public more aware of that. It's important to know who has a disease and what risk factors they have for a particular disease. So that is always important when you're treating people in the hospital, to know exactly where they've been, who they've been exposed to. This is not just for specifically Ebola. Other infections, I know Ebola has predominated a lot of what's been in the news, but there's other infections that could be here in Texas. And so it's always important, not necessarily your travel history, what do you do for a living, things that you're exposed to. Really, infectious disease is a mix between really the social aspect of a patient, their environment, and what makes them susceptible to that infection and what risk factors they have.
With respect to avoiding infectious disease altogether, what measures can the average person take?
If you're going to be traveling overseas or internationally, it's recommended that you see a travel expert. If you think about going to see a physician that's a travel expert, you think mainly vaccines. But a good portion of the visit will be looking at ways to prevent mosquito-borne illnesses, taking precautions, and avoiding you becoming sick and transmitting and bringing those infections to whatever part of the world you're traveling to. Don't travel when you're sick, and always take the standard precautions that we recommend of washing your hands, being aware of your surroundings, and taking those precautions.
Very well, Doctor. Thank you very much.
You're welcome.